This is the MediNail Pain Patch Program for Podiatrists and Other Health Professionals by Dr. Robert Spaulding and Dr. David Velarde. Read this disclaimer carefully at your leisure. It is typically included so that you do not overmarket or overpromise the results of the product. This is important. Everything we demonstrate today is important that you tell your patient to coordinate any patch application with their treating physician to be sure that the underlying cause is identified, treated, and monitored by a health professional. The MediNail Pain Patch Program, or MPP. The MediNail Pain Patch Program is also brought to you by Dr. Velarde, founder of Stargate Clinics, which is a new type of non-medicated pain clinic. The patches used by MediNail in this presentation are made by LifeWave, the IceWave, and the X39. What is IceWave made by LifeWave? LifeWave's IceWave patch product combines ancient acupuncture with a remarkable breakthrough technology patch. Your body produces heat and light, which stimulates the patch compounds to vibrate at a microfrequency that activates various molecules that are already in your body. The patch has simple amino acid crystals, salt crystals, and ionized water. One of these molecules found in your body is copper tripeptides. Copper tripeptide activation produces endorphin responses that temporarily control pain. IceWave also interrupts traveling pain signals to the brain. Reportedly, LifeWave X39 stimulates stem cells for cellular repair. Here's a copy of the original patent filed in July of 2020. You can read the abstract as to their claims. What is copper tripeptide and how does it work? Here's some basic introduction through this link if you'll either click on it or copy it and paste in your browser. Here are some NIH articles and links to copper tripeptide and LifeWave related products for your background research on this product. These are just a few and there's hundreds more on this topic. What is acupuncture? Acupuncture uses the body's meridians to control pain. Meridians are superficial dermal nerve pathways, also called dermatomes. Here are some examples of the foot meridians. The difference of reflexology versus acupuncture is reflexology has specific points on the foot's plantar surface and on the top that will activate other organ systems in the body, as opposed to acupuncture that uses meridians. So why did I bring LifeWave to MediNails? After being in practice for 26 years, I have never seen an OTC, non-medicated, non-transdermal product like IceWave that has so many positive benefits with no major risk factors that anyone with some basic knowledge can apply. It was just patented in 2020. Because IceWave has impressed me so much and demonstrates such positive pain responses on so many levels without risk, I cannot, as a podiatric physician, duplicate the effect. The fact that copper tripeptide information has been shared since 1976 shocks me that I've never heard about the immense value of this molecule. I had to share with everyone in the MediNail program and develop specific training for the foot. I share this remarkable product with everyone I meet to let them experience the IceWave wow factor. This MediNail specific lecture briefly covers IceWave product education as it relates to your scope of practice in the lower extremities. IceWave is a temporary means to control pain or discomfort. It is not a cure for the underlying causes. What is a very common topic that goes on daily with your patients? Well, when you take a history, you talk about medical conditions like arthritis and old injuries or surgeries that cause pain, like in the back, neck, hip, knee, and certainly in the hands and feet. When patients come to podiatrists with pain, many times we give trigger point injections or professional prescriptions. Podiatrists always strive to offer low-risk, cost-effective ways to manage acute or chronic pain. These are certainly ones that you're familiar with: ultrasound, lasers, TENS, topical OTC products, dry needling, deep stem massage, NSAIDs, CBD, and injections. Most of these take some level of cost, training, time to implement, multiple visits, or have odor or other limitations. How would you like to offer some real potential relief to your patients with foot and hand pain without injections or prescription medical products, not only in the feet, but other areas of the body? Here are typical areas of foot pain that you see daily that might be helped with IceWave. Here are 10 top non-infective foot conditions. Obviously, there's a lot more. Everyone here is familiar with these terms. You can read through them and brief yourself on them. For brevity, our focus today on 5 foot and hand conditions that are listed here: heel pain, neuropathy, metatarsalgia, sprains, and arthritic joints and bunions. Number 1, everyone's familiar with heel pain. 50% of the U.S. population may have heel spurs seen on x-ray, but not 50% have heel pain. Number 2, everyone's familiar with neuropathy pain, or the sensation of burning, pinpricks, or tingling. Number 3, metatarsalgia, whether it's on the top or the bottom part of the metatarsal heads. Number 4 contains the following issues: arthritic joints, bunions, calluses, and fissures. Number 5, chronic sprains, not acute sprains, but those that have been cleared with previous x-rays to rule out fractures. There's 25,000 sprains in the U.S. daily, and 30% of the ankle sprains will still have pain 1 year later. So how do we start with patching? Well, first we gently find the trigger point pain, which could be in any of these areas. Next, we want to open your IceWave product sleeves and get out a tan and a white patch. Instructions: you will find the tan or brown and white patches. You place one tan or brown patch on or near the point of pain and one white patch on the dermatome or meridian of the body, using any 2 locations at a time. You apply the patches to clean, dry, undamaged skin. Another way to think of this: consider the tan as the negative point that goes on the pain point, and the white, which is positive and circles near the tan patch or the opposite side of the body. So remember, the tan or brown patch goes on the trigger point where you can depress and feel, and the patient will tell you, or client will tell you, that that is the point of pain. And the white patch goes in a circle an inch or 2 away from that area as one method as to find the point of pain relief. So again, number 1, find the trigger point pain and apply the tan patch directly on that spot. Number 2, rotate the white patch in an expanding manner in a circle around until you find the best point of the contact that gives relief. And you can expand or the width of the circle with the white patch, again, for the best spot for pain relief. Met pain from a callus, of course you would debride it first. Then you find the trigger point pain, which would be the callus itself, and then apply the tan patch. Again, with the met pain from a callus or other area that you might have pain as a result in the head of the metatarsal, you put the brown patch. And again, you move the white patch in a manner, usually in a circle, and you can expand this circle and go to other areas of the foot to give you the best secondary relief of pain. Here is another example with heel pain. First, you locate the point of the most heel pain with your depressing your finger or thumb. Then you apply the tan patch, and then you rotate the white patch until you find the best relief of pain. Here's an example of the third metacarpal, right at the head of that metacarpal. You find the trigger point pain and put the tan patch, and with the white patch you move it in a circle until you find the best relief of pain. Here's another example of metatarsalgia, but it's on the top of the foot. When you press down on the top of the head of the metatarsal, that's where you would put your brown patch. And then the second patch, or the white patch, would go in a circle until you get some pain relief. And then you apply it. Here is another example of patching the third submet, or the metatarsal, under the third toe. Right where the digit connects to the head of the metatarsal, you put the brown patch. And instead of moving it in a circle, you take the white patch and put it in the exact opposite position. One goes on the bottom where the pain is, and the white one goes on directly on the top of that third metatarsal. Sometimes that's the best way to get pain relief. Here are 3 different options on how to treat neuropathy. The first one, where you're getting all the toes that are involved in tingling or burning, you put the central patch, where the central area of that burning and tingling, you put your brown patch. You move that white patch in a circle. Or you can put the other patch, one patch on the bottom and one patch on the top, and see if that gives relief. And then there is a third method for neuropathy. Put one brown patch on the forefoot where you're getting the most neuropathy, and the second white patch in the sinus tarsi, which is in this location right there where the ATF ligament typically is. Here is a male patient who came in with metatarsal pain from a callus on the bottom of his foot at the third submet area, and it was secondary to having multiple hammer toes. And we put the brown patch on the callus, and we put the white patch on top of the foot in the same area on the third metatarsal, and he got immediate relief of pain. Here's a lady that came in with an interdigital corn on her third toe on the medial aspect of the third digit. We put in a toe spacer, but for treating the pain, we put a brown patch right behind the digit and a white patch in the sinus tarsi, and got immediate relief. If you don't get results, here's some things you can do. You can expand further away from the point of pain, which would be where the tan patch is. Expand the white patch in a larger circle. Number 2, go to the opposite side of the tan patch on the same extremity. In other words, one's dorsal, one's plantar. Number 3, go to a larger nerve pathway of nerve complex towards the spine with the white patch. For example, in the sinus tarsi or in the triangle behind the malleolus. Number 4, go to the opposite side of the body completely with the tan being on the left and white being on the right. Number 5, patch the plantar heel of the left side with the tan patch and white on the right heel. And sometimes you get an effect that way. So these are all areas you can test. Dr. Velarde's patient encounter for heel pain on 5/2/25 with Ice Wave patches. He used 3 patches, 2 Ice Wave and 1 X39, or you can use an ion for complete relief.
So
here is the encounter.
So that's, I'm going to make sure it's the worst spot. Here or here? Right there.
Yeah.
Okay.
Yeah.
So you put the brown patch where it hurts the most.
Okay.
You take the white patch.
Okay.
You don't take the backing off.
Okay.
So I'm going to place it here. Tell me that hurts.
No.
I'm pushing hard like I did before, right? I take it off. Hurt?
Yeah.
It doesn't?
Yeah.
Doesn't hurt?
I mean, I can still feel a little bit, but it doesn't hurt like, yeah.
What about right here?
Yeah.
Still hurts?
Yeah.
Here?
No.
No pain?
Yeah. No.
Okay, you can stop.
Dr. Velarde on 4/4/25 patching one
All right, so
knee
get
of
up.
an obese female patient
It's
with
not
knee
gonna hurt.
pain and walking with a cane.
How's that feel?
Oh, yeah. I could tell the difference. Mm-hmm.
Tell the difference?
Yeah. Feels good. I didn't know you could do that. But you see how this, and
Here is the same obese patient walking with both knees patched.
Now we patched both knees.
now see how much better I walk even without my cane. Ooh, that is so cool.
If you still do not get relief, add the Ion or the X39 to the Ice Wave patch. Ion helps reduce inflammation. It's great for arthritis. Key points for patch placement. Most reasons that you don't get immediate patient relief is not taking the time to properly find a meridian that works. Sometimes you must place the white patch even on the other side of the extremity or opposite side of the body to see relief. As a physician, you can even try to peripherally patch around open wounds, ulcers, fractures, and draining areas or infections for pain control while co-treating these conditions by conventional means. Here are some other conditions that you can try, either trauma to the bottom of the heel, or calluses, or ulcers, or fissures. Caution, remove immediately if you feel discomfort or skin irritation occurs, or if you have an allergic contact allergy to it. Do not use directly on wounds or damaged skin, but around these areas. It's external use only, of course. Don't use it pregnant or nursing. It just hasn't been tested on these conditions. It's not intended for children. Again, it hasn't been fully tested on children. Some people have taken off their used patches and tried it on children, but this is not something that's recommended in this particular lecture. The product needs to be stored at room temperature. LifeWave products may activate at 80 degrees and above, so do not leave in a hot car or direct sunshine, or don't carry them in your inner clothing pockets or allow sources of heat to come in contact with patches or LifeWave sleeves containing these patches. Ice wave patches, there's other applications anywhere on the body. Patches can be worn anywhere from 12 to 72 hours for the ice wave pain patches before discarding. We've seen effectiveness up to that 3-day period. Keep well hydrated while using this product. It tends to create dehydration if you don't. You can just tape the patches in place until the effectiveness has been determined to avoid wasting the patches. These patches can be applied almost anywhere on the body for pain relief. These are technically, some of these are out of our scope of practice, but they are so readily available as an OTC product. I think that it's safe to use these, especially if there's a follow-up with their physician who's treating those other areas of the body. Here's some additional information and locations for getting knee pain relief. Here are some placements for headaches and hands and shoulders. Here is some additional information for neck and shoulder applications. Results of ice wave patching. Some people get immediate relief. Some people it takes hours or days. Some people might self-administer and move it around and find better pain control points. It doesn't cost much to try it out for your patient population. It may lead to helping patients with other body aches and pains that you normally wouldn't treat. It may lead to increased referrals, may lead to clients not having to depend on their medications or injections as often, and may lead to other LifeWave products that might help improve immune or metabolic health conditions. And patients can choose to obtain these life products with a better cost savings through the company. And patients may introduce IceWave to their friends and relatives. You can expand into 10 other LifeWave products that can help overall health that we haven't talked about yet. Not all of the molecular aspects of the applications of this product are fully understood, but we look forward to your feedback and seeing if you have come up with different patch protocols. And I admit that my experience with this is limited to a few months, but the preliminary results have been very encouraging. Not everyone responds to these products in the same way, but offers an inexpensive optional pain control method in your arsenal of pain control options. The difference between the IceWave and the LifeWave X39: IceWave is more for temporary relief of pain. LifeWave X39 has other long-term positive benefits that you need just a complete education just on that product alone. Here's some more research on LifeWave under their resources studies on their homepage, lifewave.com. The book on the left is an essential book to understanding more about how copper peptides affect every aspect of the body. And the one on the right will give you additional information on patching. The only way you're going to believe in this product is try it yourself. Whether you have pain or some family or friend has pain, try it out and just start patching, and I think you'll find a whole new result in your ability as a physician to help control pain. We've barely cracked the surface of all the products of LifeWave, but for information to sign up for just the IceWave, the MediNail Podopalmer patch program, you can get with myself, Dr. Velarde, or Cheryl at the 423-756 foot number, or my LifeWave number. Link is lifewave.com at Dr. Spalding. Dr. Velarde can be reached at lifewave.com at Stargate Clinic. And Cheryl Morgan can be reached at CherylMorgan59 at Gmail.